Lewis. And thanks to both of them for sharing their stories. Joining me now to discuss further is breast cancer surgeon and author of Treat It, Beat It, and Move On, Dr. April Spencer. Dr. Spencer, so great to see you.
Oh, you as well.
I mean, your title is it really does provoke an optimism.
Yes.
You know, but let's first begin with hearing these ladies talk so openly, genuinely, and honestly about their journeys.
Yeah.
How important is that really a first step to help people understand what the fight against breast cancer is all about?
I think that is an essential first step. We're just not talking enough about it. And although we are raising awareness, I think what this piece highlighted by having this conversation around the table, like we oftentimes do with our girlfriends, is that we've got to start raising our action.
And what do you mean?
In the sense that there are things that we can do to lower our risk other than just being aware of breast cancer. So what are we going to do about it?
Yeah, what are those things? Because, I mean, as we're all kind of leaning on our doctors, you know, for our regular exams, you helped remind me that the numbers of the 1 in 8 has changed. Women are younger who are being diagnosed, and many of those women are escaping early diagnosis because they're not even of an age yet required to get a mammogram. So what are some of the things, I guess, that we can do to promote our own better health?
Sure.
Especially since it is affecting so many more women at a younger age.
Yeah, so some of the things that we can do is, number one, just be your own advocate. You've got to make sure you're aware of your anatomy. Just know your body. And it's not about like if you feel something, because, you know, we've all heard do your monthly breast exams, and a lot of the national organizations in the breast community have gotten away from that. Not that there isn't any value in that, but a lot of women were just feeling for a lump and they ignored everything else. So our goal now is if you see something, say something, not just if you have the lump underneath the arm.
What are those things that you might see?
You may see nipple discharge. You may see rashes that are new. There may even be a lump underneath the arm or discoloration. Those can be silent signs of breast cancer. And so, yes, so just be your own advocate. The other thing that's extremely important is just to know what the screening guidelines are to make sure you get screened. But for a lot of young women, they're getting breast cancers at younger ages. They're not even at the screening age. So what do you do there?
And that would be 40.
Yes, so the
40 is usually when you go get your
40.
first mammogram.
Yes.
Unless there's a predisposition in your family.
Exactly.
Like that.
And so oftentimes people don't necessarily have a family history or the breast cancer gene. But again, be your own advocate. Talk to your family about the family history and talk to your doctor. So if you're concerned about it, you can share that with your physician. And if there are some early signs, we still can make sure we get a mammogram ordered for you, even if you are not at the screening age.
I wonder, in this month that we are all reminded the importance of the advocacy and the awareness that comes with breast cancer awareness month, what are you hoping people will learn, will grasp this month that you think perhaps has been overlooked or undervalued even?
Yes. A couple of things. One, we are seeing an increase in a sedentary lifestyle. A lot of us are working from home. So I definitely want to encourage women to try to be more active. You know, if you're smoking, try to quit smoking and reduce your alcohol intake. A lot of that kind of increased during COVID. But I think one missing piece is understanding the importance of the lack of rest and increased stress in many Americans, not just the young, but especially the young. And I talk a little bit about that in my book, you know, Treat It, Beat It, Move On, from a praying surgeon's perspective, just the role of spirituality and faith. And Ananda talked about how she kind of wanted to at first kind of go at it on her own, and she was very courageous for that. And I've been doing this for over 20 years in terms of doing breast surgery, and I've seen a lot of women do that. And what I have observed is if you stay away, it doesn't mean it's going to go away. So try to complement that with being the surgeon in your life and cutting out things
you are building
that aren't adding value
even before the diagnosis. That's
absolutely.
what I'm hearing from you. Dr. April Spencer, fantastic. Thank you so much. Glad you could be with us today.
Thank you.
Really important.